Tadgh, those complaints, staff tested, requested to continue, were positive, continuing to work, staff in scrubs leaving together in taxis, people not being isolated who'd left nursing homes for a period of hours, families not being told about COVID cases. This is scandalous behaviour.
Well, I suppose in the first instance, Shane, it's important to remember that there are, as your reporter has said, there are almost 600 residential care settings across the country.
Yeah, 300 complaints.
Yeah, absolutely. And each of those, well, they're all concerns, and I suppose it's important that that all of those concerns that are brought to the attention of either the provider, whether it's the HSE or indeed whether it's a member of
concerns is a bit of a euphemism here. Like, this is shocking stuff. Staff who tested positive being asked to work.
Well, I mean, obviously all of these are completely and absolutely inappropriate, but it's important to point out that they're unsubstantiated. What they are is that they're issues that have been raised by either relatives, by residents, or indeed by nursing homes themselves, whether it's public, private or voluntary. And all nursing homes have a responsibility, a legal responsibility, to investigate all of those concerns or indeed complaints when they're brought to the nursing home. So all of these would have been dealt with, and I think HIQA in their statement made the point that if they are substantiated, then they have the authority to deal with providers on a one-to-one basis. And also it's important, I think, from your listeners' point of view, to understand that if people are not content with the response from the provider, whether it's the HSE or indeed a private provider, that there is recourse to the Ombudsman. So, but it does paint a very challenging picture right throughout COVID for nursing home care, and
it goes a bit further than that. I have to put this to you. It paints a picture that at least some, and I won't go any further than that because obviously there's a lot of very reputable nursing homes, but it paints a picture that at least some nursing homes in this country failed in their duty of care to residents.
Well, if nursing homes fail in their duty of care, then they would lose their licence, as it were, and they would lose their registration, because there is very strict and appropriate regulation of nursing homes, whether it's the HSE run or indeed whether it's private run. So
yeah, but regulations don't stop people getting into a taxi together wearing scrubs. Regulations don't stop if it is true some nursing homes saying to staff who tested positive, "You're grand, come on into work anyway."
Yeah, look, that's absolutely indefensible. I'm not saying for a second, Shane, that any of these are defensible. They're absolutely indefensible, but they have to be proven in the first case. And I can assure you, from a Nursing Homes Ireland point of view, that all of our members take their responsibility absolutely seriously. It's been a very challenging period for the entire health service, and nursing homes have been at the coalface, if you like, or at the front line of dealing with the tragedy presented by COVID. And there's learnings for everybody here: the HSE, HIQA, Nursing Homes Ireland, and indeed Minister and the Government, as outlined by the Oireachtas Committee report and indeed the expert panel report last week. So we do need collectively, and there's a shared responsibility on all of us, to address these and other issues that continuously crop up.